How many more heartbreaking losses must we witness before we address the urgent need for mental health support, especially for Black women? Today we're going to dive into an honest conversation about Black women and mental health. And if you've ever questioned whether representation matters, this video is for you. Because when we predominantly work with people from cultures other than our own, ensuring that we are culturally competent is critical. So make sure you stick around to the end because we're going to talk about an inclusive approach to healthcare services that will be beneficial to you. Hi, my name is Tomesha Campbell and I'm the founder of Enhanced Black Women's Health. And I'm here to guide healthcare providers like you in revolutionizing care for Black women through education and collaboration. At the time of this recording, the lack of mental health support in the United States, especially for Black women, is glaring. The recent loss of Dr. Vani really has shown us the immeasurable impacts of the mental health struggles that are experienced by Black women in the workplace. As someone who battled suicidal ideation and self-harm in a toxic work environment, Dr. Vani's story resonates with me personally. I understand the impact of a toxic environment on my mental well-being. That's why, as healthcare providers and educators, we must address the mental well-being of Black women comprehensively. We cannot afford to overlook how mental health impacts our clients' ability not only to thrive, but literally to survive. And as we know, Black women often navigate a complex intersection of race and gender. The systemic barriers they face contribute to heightened stressors and mental health challenges. And the societal expectation of the strong Black woman only intensifies this struggle, creating an environment where the desire to avoid appearing weak leads many women not to seek help. So today we're going to explore transformative approaches to support Black women's health effectively. But before we dive into these approaches, I want to hear from you. How do you currently prioritize mental health in your practice? Share your thoughts in the comments below. And if you're passionate about enhancing your skills of providing equitable care to Black women, consider joining the Enhanced Black Women's Health Community newsletter. It's a weekly digest of insights and resources that are curated just for you. The link is in the description box below. So now let's explore 3 transformative approaches to support Black women's mental health. Approach number 1 is lead with empathy. Empathy is the key to creating a supportive environment for your clients. I've personally experienced the difference that empathy makes during my own mental health struggles due to working in a toxic work environment. However, let me be clear. I'm not suggesting you act as a therapist if that's beyond your scope of practice. However, I encourage you to actively listen and acknowledge the systemic impacts your clients are experiencing. By doing so, you can ensure comprehensive mental health support. Approach 2, representation matters. Representation matters in mental health services because when clients feel represented, it creates a sense of being seen and heard. Thus, cultural competence is highly critical when working with diverse cultures. Through cultural competence, we can practice an inclusive approach that affirms individuals and contributes to a more equitable system. And specifically, we can do this by tailoring care plans to address the intersectional nature of experiences. In doing so, we can dismantle barriers and support Black women by ensuring representation in mental health services. Approach 3, break the silence. Combating stigma requires we break the silence. That means talking about the benefits we've experienced from therapy, especially if we were initially apprehensive at first. Because it might seem counterintuitive, but sometimes people need to hear about our experiences before they will consider trying it themselves. By initiating open conversations about mental health, we create a non-judgmental space for support. And that empowers individuals to seek help without fear of judgment. And in doing so, we can address the stigma within the Black community and ensure that Black women feel heard and supported. Now, thank you so much for watching. And remember, your commitment to these approaches can contribute to transformative change in the lives of Black women. Stay passionate, stay informed, and let's revolutionize healthcare for Black women together. Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.